Good morning, good afternoon, good evening to our friends around the world. My name is Luciana Da Silva. I'm in for Tanya Friedman today. She is traveling. If you look up into the sky, she might be flying over you right now. In the meantime, today on Onwards and Upwards, we are going to be discussing the NCLEX. Yes, this is Onwards and Upwards, the Connetics USA live show for global nurses. In the chat, please put in your name. Tell us where you are from. We love seeing how people from all over the world are watching this show today. And we have the wonderful Paul, Dr. Paul, as we should say now. How are you doing, Paul?
Good morning. I'm doing good. What about you?
I'm good. Thank you so much.
Thanks for
I know
having
that you
me.
have some exciting news to share with some of our viewers here. Such an amazing accomplishment.
Oh, yeah. So I graduated with my doctorate finally 2 weeks ago. After 4 years, it's been a long time in school, and I'm happy to take a vacation. But we're doing
And
this class first.
that's why we've got you on the show today, because everyone watching right now, we are going to be having an NCLEX bonus class in the second half of the
Mhm.
show today with the wonderful Paul. If you have not met him yet and his expertise, Paul, tell us a little bit about yourself and your background. Dr. Paul.
Yeah. Oh, thank you. So I have an experience. I have more than 10 years. Actually, it's 14 years now of experience with NCLEX education. I was a licensure exam reviewer in the Philippines and an NCLEX instructor since 2008. I'm a BSN graduate in 2007. Took my master's in the Philippines, moved here to the United States to start my career in 2017. Been here 5 years, finished my doctorate. I'm also a family nurse practitioner, and I have a nurse educator certificate. So that's about me. I also practice as an ER nurse and currently transitioning to my nurse practitioner role. So it's going to be exciting. But my passion is really to teach and help nurses pass their NCLEX exam. It's been what I wanted to do since when I was in nursing school. So yep.
A teacher, being able to teach others is such a gift. Let's say hello to some of our audience here in the chat. We have Giselle Lilani, I believe, Brazilians. How about that? And let's see, Agata from the UK is watching. We've got Kate from Pinas, Hazel from the Philippines, Irene from the Philippines, Janisa, Qatar, Tony from London. I think I almost named every single continent just now going through that.
Nice.
So let's get started. Paul, let's go with the basics here, okay?
Mhm.
What is the NCLEX?
So the NCLEX stands for the National Council for Licensure Examination. It's basically the licensure exam for nurses to be able to practice as an RN here in the United States, in Canada, and Australia is already requiring NCLEX RN exam for foreign graduates as well. So you won't become a nurse until you pass the NCLEX RN.
Okay. Now, there are several different parts of the
Mhm,
NCLEX exam.
mhm.
Tell us about that.
So there are for the blueprint of the exam, there's four major client categories, which are actually so some of the categories have multiple items below it. It's a total of eight client categories. Depends on so there's different percentage. For example, safety and infection control would have 17 to 23%, as well as management of care. And then we also have health promotion, which includes geriatrics and pediatrics and normal OB-GYN. And then we have physiologic adaptations, which are the medical surgical conditions, psychologic alterations, pharmacology, basic care and comfort, and risk reduction potential. So those are the stuff that comes out in the NCLEX, but in the grand scheme of things, it's just all of your major nursing courses put together and combined together to make the eight client categories. And these client categories are dictated or created by the National Council of State Boards of Nursing, which are actually all the boards of nursing in the 50 states here in the United States. So they get to decide what comes into the exam, the passing rates, the passing standards, and they do that every 3 years. In fact, in 2023, there will be a significant change in NCLEX, and I'd like to talk about that in the future talk shows.
Okay, wonderful. Well, it's good. You definitely give us a heads up about that. And
Mhm,
everyone knows that we do shows about NCLEX here pretty
mhm,
regularly. We try every
mhm.
few months to make sure that all of our nurses know about the NCLEX and are prepared about the NCLEX. So watch out because Paul will be back on the show to talk about
Right.
that. Paul, tell me, why is it important for a nurse to have the NCLEX? Does a nurse need the NCLEX before coming to the United States and beginning to
Mhm.
work?
Well, that's a very good question. As I said earlier, NCLEX allows you to practice as a nurse. It's a licensure examination, which means um, nurses are required to take it to get their licenses to register for the board of nursing. Without passing the NCLEX, you will not really be able to practice as a nurse. So that's your license. Now, for foreign graduates, they're also allowed to take the NCLEX. There are different NCLEX testing centers or Pearson VUE testing centers around the world, Europe and Asia. Um, but for the immigration purposes, I believe they have to pass the NCLEX first before the immigration process could be started. So it's very important, very um, important for nurses, particularly foreign graduates, to pass the NCLEX as soon as they could, because it will start the ball rolling. So without the NCLEX, cannot be petitioned or hired by a U.S. employer as well. And of course, here in the United States, as soon as the students graduate from BSN or ADN school, they take the NCLEX within a few months to be able to practice as a nurse.
And here at Connetics USA, we do have an NCLEX scholarship now
Mhm.
to where our nurses can come and or can take the NCLEX exam. We pay for it. It's free for you. You are working with wonderful people like Paul's company Aspire for an NCLEX course completely paid for by Connetics. It is a scholarship. So you have to apply in order to see if you qualify. I'm all rhyming today, Paul. Go to connecticsusa.com/application. Our recruiters right now are waiting for you, and they will be contacting you as soon as you fill out that application and give you more information on the NCLEX scholarship. If you have your NCLEX ready to rock and roll to come to the United States, I want to take a look at the chat really quick again before I hand it off to Paul for your bonus class. We
Mhm.
have Carl from the Philippines, Jeff from the UK. Hello from Doha, Qatar, from Bosch, Carol from Kenya, Germany in the house, Bonyang, Nepal. I could just keep reading this over and over. It's so amazing to see how many people from all over the world are watching. Right now, for all of our viewers, I'm going to let Paul take it away with a special NCLEX bonus class from Dr. Paul from Aspire. Enjoy,
Thank you,
everyone.
Luciana. Thank you. All right, guys. Well, Luciana already called everyone out, and thank you for joining our show today. We're going to talk about nursing delegation. Delegation is one of the key topics for NCLEX. It comes out under the management of care. So delegation is a legal process where nurses can hand off their responsibility to other members of the healthcare team, such as the licensed practical nurse or the certified nurse assistant under the supervision of the nurse, of course. And there are quite a few questions in NCLEX about delegation. In my last show with Connetics USA last month, we talked about prioritization, and today we're going to talk about delegation. So give me a bit while I um, set up my slide real quick. And while we're doing that, I want you guys to participate with me. This is going to be a very interactive show. I'll be doing a quick lecture about delegation principles in about 10 to 15 minutes, or probably 20 the most. And then after that, I'll be asking questions. I prepared 5 to 10 questions today. Um, for you guys, and I want you guys to participate with me and tell me your answers through the chat box. I can see all your responses in Facebook right now on my screen, so please help me with that. Again, after my mini lecture, we're gonna do a question and answer kind of thing. I'm gonna explain to you the answer, but you're gonna have to participate with me in providing your answers. Okay, so let me just set up this thing real quick, and I should be good in a few. All right. Okay. So here we go. It's still uploading, and should be good. 1 second. All right. So we have people watching from Ghana, from Hong Kong, from um, Saudi Arabia, from the Philippines. Is it applicable for international nurses? One of the questions. Yes, NCLEX is applicable for international nurses. Like I said, if you want to practice here in the United States, it's the only way for you to get over here because it's the license to practice here. And NCLEX is not hard. I can attest to that. Even the entry exam, success is time and discipline. That's correct. And I think I've seen a question here. I would like to work in U.S. Can I bring my husband together with me? Yes. I'm not an immigration lawyer, but I believe Connetics USA have covered that question in many of their talk shows. In the past. But yes, under the immigrant visa category for nurses, for foreign nurses to come over here to the United States, you are able to bring your spouses and your kids under 21 years old. I may be wrong, but I think it's 21 years old. Can bring them over here. They would have green card as well, like you as a nurse. All right. And of course, for the scholarship, yes, Connetics USA and Aspire RN has partnered in providing scholarships for NCLEX. And again, we will flash the link later where you can apply. Connetics will screen you first, and then once you qualify, they're going to submit you to Aspire RN to undergo this intensive program. After you pass the NCLEX, the recruiters are going to submit you to the hospital so we can get the petition started. And I would encourage everybody to really apply because the petition process right now, immigration process is moving really fast. Back in my time in 2008, when I passed the NCLEX and started the process, it took me 9 years to get here to the United States. But now it's only taking a year or two. So we flashed that link at the bottom of the screen earlier, and we're going to do that again later. It's connecticsusa.com/application. So that's where you submit your information, and the recruiters will screen you and will submit you to Aspire RN for a scholarship qualifying exam and stuff like that. But I would like for you to send your application to this link, and we'll talk to you and run you through the process and let you know what's gonna happen next. All right. And so, without further ado, let me continue with my class for today. The other questions we're gonna try to answer that within the day, or we're gonna point you to resources where you can find the answers because I believe we've covered that in a lot of the previous talk shows. And Tanya, Connetics USA also do a lot of shows with immigration lawyers who can actually provide you like not legal advice, but sound advice from a professional, from an expert in immigration law. And we know it's very complicated. So I want to stick to what I'm expert with, which is the nursing curriculum, which is NCLEX classes. So I'll do that for now, and whatever we can help you with, we'll answer that later. All right. So delegation, like I said, is very important in NCLEX. There's going to be a couple of questions about delegation because it's part of the management of care, which is one of the largest percentage in your NCLEX RN exam. And delegation is just basically passing on the responsibility to other members of healthcare team. but you are not passing the accountability. Which means if you're the nurse and you're telling your, for example, your certified nurse assistant, can you take my patient's vital signs? When your CNA takes the vital signs, the CNA is responsible to get that vital signs, but you're still accountable. Meaning, if there's an abnormality in vital signs, it is your responsibility and accountability to recheck the patient and make sure everything's okay with the patient. So we're doing this so we can focus more on the nursing tasks, the tasks or scope that only nurses could do, and so we can provide efficient care. So before we start with delegation, let's talk about the different roles first. Let's begin with RNs. So there are two types of RNs depending on their education, right? Outside the United States, I believe most RNs are educated at the baccalaureate level or BSNs. Baccalaureate nurses are trained to provide care to individuals, to families, to communities. They can provide care in both structured, which means a hospital setting or a clinic, or unstructured health settings like mobile clinics, like public health or community health. So that's what BSN degree is for. Associate degree nurses, so BSN degrees are usually 4 years. Other countries might be longer or shorter, but you can tell from your diploma at the time of your graduation. If you received a bachelor's degree, it should say there. Now here in the States, associate degree nurses, which undergo school for about 2 years, can also practice as a nurse. Both associate degree and baccalaureate degree nurses are able to take the NCLEX per the NCSBN rule. So there are two types of nurses. The associate degree nurses are also nurses. Their scope, the baccalaureate and the associate degree RNs, have equal responsibilities. They're equal in all their scope of practices. So there's really not a lot of differences with associate and baccalaureate degree. But by definition or competency, associate degree nurses can perform care with individuals and family. Let's include families in a structured healthcare environment. So usually hospitals or clinic, majority of nurses work in a structured healthcare environment anyway. But like I said, the roles or the scopes of these two types of nurses are the same. The only difference is the education. One is the baccalaureate degree or bachelor's, and the other one is associate. Um, Hello, guys. Hello, Ma'am Anna. Hello from Texas. By the way, I'm from Texas, guys. I'm here right now in Houston. And right now it's about 9:18 a.m. All right, and thank you for joining us. Anyway, RNs, you have to remember that RNs, registered nurses, cannot delegate initial assessments. So when you have a newly admitted patient, new patient in the ER, new patient coming into your unit, it should be you that will perform the assessment. You cannot delegate that, right? Because you're going to have to document your head to toe assessment. That is non-delegable, all right? Evaluation of patient. So for example, we gave a medication to the patient. When you evaluate the effects of the medicine, if it has been effective, that's the nursing responsibility. That is non-delegable. Another example of evaluation is if the patient understood your teaching, or if the patient can perform the skill or procedure. Like for example, you're teaching how to insert an insulin or poke themselves with insulin on the tummy. It is your responsibility to evaluate that. It cannot be delegated. Nursing judgment, of course, there are certain scenarios where the nurses would question the orders of the physicians or providers because they feel like it will put their patient in danger. So that is non-delegable. Patient and family education is the responsibility of the RNs. It cannot be delegated to any member of the healthcare team. And performing nursing diagnosis and nursing care plans, charting, stuff like that can never be delegated by RNs. All right. And I'm going to show you a table later of what nurses can do and what the other people could do. Right now, aside from RNs, we have LPNs. They also take the NCLEX, but it's called NCLEX-PN. We take the NCLEX RN, they take the NCLEX PN. Licensed practical or vocational nurses are in school for about a year or two. They are taught how to perform the nursing skills. So if you go back to your bachelor's degree or associate degrees, if you remember your fundamental of nursing skills, they could do all of that because they are trained to do that. All right. They assist in implementing a defined plan of care. They assist the nurses in implementing a defined plan of care. Um, the nurse, the RN sets the plan of care. The LPNs follow the plan of care. They cannot create their own nursing care plan. They work with the RNs for that defined plan of care. They can also perform procedures as long as it's within protocol. So protocol means there's step-by-step guide of how to do it, what should be watched out for, how long do we need to monitor this patient after we give this medicine or perform this procedure, or how to do EKGs. This can be performed by LPNs, all right? They can also assess, but not initially. Initial assessment is solely for RNs and not LPN. You have to remember that. Can LPNs assess? Yes, but not initially. All right. Now, when LPNs assess, they can determine the abnormal versus normal. What is normal? What is abnormal? If it's abnormal, they have to cascade that information to the nurse or the RN so the RN can verify and check out what's going on and report it to the physician. All right. So it's still the responsibility of the RN. You have to remember when you're here in the States, LPNs are also called nurses. So it's important to verify um, their certifications or licenses so we can delegate appropriately. Because you might be delegating a lot of RN tasks to an LPN. You remember your license is at stake here because you're the nurse and you're the one delegating, right? So they can differentiate between normal and abnormal, but to act on an abnormal finding, they have to report to the nurse first or the providers. And they can take care of physiologically stable patients. Unstable patients have to be taken care of RNs. Now, LPNs can also work in the hospital. I've worked with a lot of very, very good able LPNs in the ER. We have different tasks. They can perform most of the nursing tasks except charting and initial assessment, except blood transfusion, stuff like that. I'm gonna go through it one by one. And some hospitals still employ LPNs, but mostly I think LPNs are working in the clinics now and home health care where there is a nurse and it's like a team nursing care kind of setup. But they're still existing and they're very much here in the United States. But the question is, what can we delegate to them safely and legally, and what cannot? So that's what we're talking about right now. And then later, as we finish the class, we're going to go to the question and answers to apply our learning or knowledge about delegation. Now, so we now talked about the RN, and then we talked about the LPNs. Now let's talk about UAPs. UAPs are unlicensed assistive personnel. These include certified nurses assistant or CNAs, patient care technicians or PCTs, techs, and scrub techs or whatever. So there's different names that we use depending on the unit and depending on the state. So here I'm working with as an ER nurse here in Texas or in many areas that I've worked at, or many different hospitals. We call them PCTs, patient care techs. So they're still unlicensed assistive personnel, but they're certified. They're certified by a board, but they're not licensed. So licenses and certifications are different. Licenses, you're held to a higher professional standards, code of ethics, ethical legal consideration, and that license is heavily scrutinized by the board. Certifications, on the other hand, are skills that you've learned on a school for about 3 or 6 months, and you're highly skilled to perform these procedures. So UAPs or certified nurses assistants, for example, that's what you will commonly encounter in the NCLEX, have very limited scope of practice. They can only perform direct patient care such as bathing, transferring, ambulating, feeding patient, toileting, vital signs, taking the height and weight, checking the eye and nose. They could do that. They can check urine specimen. They can check blood glucose because those are skills that we can teach them. They can also perform indirect activities such as housekeeping. In the ER, they help us change our beds or clean up our rooms for the next patient. They can transport stable patients. If this is an unstable patient or ICU patient, it should be the RN. And they can also stock supplies. So basically, everything that's can be done by an unlicensed person without think about it as, if this task can be safely delegated to someone and will not cause the patient to have severe complication or die from this procedure, then we can safely delegate that to UAP. For example, a patient needs to ambulate on the hallway with a walker. That can be done by a UAP or a CNA. Or another example, we need to take a vital signs or repeat vital signs for a patient that was here in the ER, for example, for hypertension. So if it's a repeat vital signs, they can definitely do that, all right? But their scope are very limited. Now, on the next slide, I'm gonna show you the different things that they can do. All right, we can compare them, the RNs, the LPNs, and the UAPs. If you guys have questions, please put it in the comments because I'm watching the comments, and we're gonna be done in a bit. We're gonna do question and answers after this slide, so let me know if you guys are ready, okay? But we're gonna run through it real quick. RNs can perform plans or create plans or care plans, can provide nursing interventions or nursing diagnosis, can assess patients, especially initial assessments, admission assessments, can provide teaching and education, can evaluate outcomes of care, can discharge patient or provide discharge teaching and instructions, can insert, manage IVs or intravenous medications, blood transfusions, everything that's related to IVs are for RNs. Any invasive procedure for RNs, right? Pre-op and post-op care, that's for RNs only, especially if it's the first day, 24 hours, because you got to monitor for bleeding and infection. Triaging or assessing the patient, checking if the patient is worsening or getting better, it should be the RN, all right? Receiving and giving report, RN to RN, and RN to RN report is what we call it, or handoff report or bedside report, or shift report. It's RN to RN, of course. Blood transfusion verification is done by two nurses or two RNs. LPNs cannot verify blood transfusion. It should be two RNs. Applying restraints and monitoring restraints are responsibility of the RNs. Performing codes or ACLS codes or code blues and rapid response is a responsibility of RNs, and LPNs definitely cannot do that. I think we have a little question here. Should they be all NCLEX passers or just RNs? Um, Hold on one sec. What I said earlier is LPNs also take the NCLEX, but it's a different NCLEX. It has a different blueprint, or client categories or percentage of client categories. They have different number of items. I think it's minimum 65. And their exam is called NCLEX PN. If you are an RN, you take NCLEX RN. You don't want to take PN because your scope is going to be, you know, narrower if you're a nurse. If you're an RN, so you just take the NCLEX RN so you can practice as a nurse, because LPN requires you to work with an RN, right? But so they take NCLEX PN, RNs take NCLEX RN. UAPs can take certifications for certified nurse assistant or patient care technician certified, but those are not licensure exams. Those are certification exams, particularly to the skills that they've learned, right? So they have assessment skills too, but very narrow, right? They're not allowed um, to assess critical patients or abnormal findings, right? And for LPNs, they can take care of chronic but stable patients. Yes, chronic patients like hypertensive patients, diabetic patients, congestive heart failure patients, as long as they're stable and there's no acute conditions affecting them. They can take care of post-op patients, particularly after 24 hours. They can administer oral IM subcutaneous medications, including narcotics. But IV meds are solely for RNs. I know when you get to practice here in the United States, some hospitals have a policy to allow LPNs to give IV medications. That's hospital policy, but let's focus on your NCLEX first. IV medications are only for nurses, all right? RNs particularly. And they can take care of MI patients as long as it's more than 72 hours. They can take care of CVA or stroke patients, spinal cord injury patients, as long as they're stable and there's no acute conditions. They can manage ventilators or monitor ventilators. They can perform coma scales. They can perform sterile procedures as well. They can take care of contagious patients like RNs. They cannot teach patients. They cannot provide instruction. They can only reinforce teaching. All right. They can also take the routine data collection, such as doing assessments of patients. Or, for example, I want to do a respiratory assessment. LPNs can do that. But again, the initial assessment should be the nurse. The follow up assessments can be done by LPNs, right? Dressing changes, in and out Foley can be done by LPNs. Nasal or oral suctioning, assisting healthcare provider with procedures if nurses are not available. All right. You guys are able to pick that up. Now, for UAPs, they can take care of stable patients. They can feed patients, but oral feeding, nasogastric tube feeding can only be done by RNs and LPNs. Again, nasogastric feeding or tube feeding, whatever tube, if this is gastrostomy tube or whatever tube, is only for RN and LPN. UAPs or CNAs can provide oral feeding only for stable patients. All right, they can check ionos, they can check vital signs for you, they can do range of motion exercises for patients, activities of daily living. We talked about that earlier, like bathing or hygiene, or sleeping or promoting elimination. They can do that. They can measure output from indwelling catheters, but they cannot insert indwelling catheters. Only RNs can do that. All right, indwelling Foley. They can transport stable patients. They can transfer patients from bed to chair, chair to bed. They can obtain urine specimen, glucose levels. Those are easy tasks or skills that if something happens, patient will not die. So always remember, if I have a procedure or task that if something wrong happens, will not cause the patient to die or have severe complications or a permanent disability, I can safely delegate that to the UAP. If the skill that we need to delegate can have severe complications or can cause the patient to die or have permanent disability, then UAPs certainly cannot perform those tasks. All right. So NCLEX SIP, whenever you see the word show, explain, monitor, teach, check, assess, demonstrate, UAPs cannot do that. Only RNs and LPNs. All right. Particularly the teaching part, it's for RNs only. All right. So just keep popping your questions into the comments, and we're gonna try to answer. Our team members with Connetics are providing answers right now into the comments. All right. Any questions before we go to the question and answer part? I have 10 questions here for you guys. I want you to provide to me the answers. The options are going to be A, B, C, D. All right. If you guys are ready, can you go to the comments and type ready? Because I'm going to flash the questions next, and then you're going to tell me your answers. All right. Ready? Can you type I'm ready so we can proceed with the questions if you are still with me right now? I need your participation for this. All right. All right. So a few people are already ready to go to the question and answers. Don't worry if you didn't understand the class. You can always review this later. We're gonna upload it in Facebook and YouTube. Okay, and we're gonna apply what we've learned through the questions. I'm gonna explain to you the answer, right? But I need you to provide the answer to me first, all right, before I explain what the answer is. And if you can record your scores, I want to see your scores after we've gone through the 10 questions, okay? So make sure you tally your scores, and we'll see your scores after the class, all right? All right, I think there's a lot of people who are ready to do the question and answers now, all right? Okay, so question number one. A client has had a tracheostomy for 2 weeks after a motor vehicular accident. Which task could the RN safely delegate to a UAP? Which can you delegate to a UAP? Teach the client how to cough up secretions, change the tracheostomy trach ties, monitor if client has shortness of breath, or perform routine tracheostomy dressing care. Which can we safely delegate to a UAP? I'll give you about 30 seconds to process this question, and you tell me your answers in the comments section. I need my coffee. It's early here in the United States. All right, we have dissenting opinions, different answers. So definitely letter A is the responsibility of the nurse. Only the nurse can perform teaching, correct? Monitor of the client's shortness of breath can be done by both RN and LPN, right? We're down to B and D, which is most of the answers are B and D. Guys, letter C is not a responsibility of a UAP. Remember, if you see the word monitor, UAPs cannot do that, all right? UAPs are unlicensed assistive personnel. So the choice is between B and D. The answer is actually letter D, all right? Let's flash it. Letter B, changes to tracheostomy trach ties can only be done by the nurse, all right? Because the tracheostomy can actually come out if performed incorrectly. There is a risk for the tracheostomy tube to come out when changing ties, all right? So therefore, if it comes out, the UAP is not allowed to put it back in or perform any procedures for breathing. We cannot delegate that. That's very risky. The patient can die when we do that. So that's only for RNs, right? Now, dressing care, they can do, all right? Because dressing care is a skill that we can teach anyone. Even family members can be taught how to change dressings. You know what I mean? So UAPs can do that as well, which means if they performed it incorrectly, there's no immediate harm to the patient and patient will not die. We just have to change the dressing, right? So answer is letter D, right? Remember, UAPs can only perform tasks that will not cause the patient to die or have permanent disability, all right? You cannot let them perform B, which is most of the answers here, because changing tracheostomy type puts the patient at risk for that tube to come out and can cause airway disturbance, and the patient may not breathe. Remember, tracheostomy is for breathing, all right? So answer is letter D. That's all right. We still have 9 questions. Number 2, which one of these tasks can be safely delegated to the LPN, licensed practical nurse? Assess the function of a newly created ileostomy, care for a client with recent complicated double barrel colostomy, provide stomach care for a client with a well functioning ostomy, or teach ostomy care for a client or to a client and their family members. What is your answer? I'm seeing some answers now. All right. I'm waiting for more answers before I say the correct answer. I think we all got this correctly. The answer is letter. Can we delegate assessing the function of a newly created ileostomy to the LPN? Letter A. No, because it's a new ileostomy. You cannot delegate that. Remember, new patients with new procedures or newly admitted or needs first assessments can only be done by RN. So letter A, you cannot endorse that to the LPN. That's for the nurse. How about letter B? Care for a client with complicated colostomy. You see the word complicated? Remember that LPNs can only take care of stable patients, right? If it's complicated or critical cases, that's for the nurse. So A and B is for RNs, all right? The answer is letter C. Very good. Most of you got it correctly, all right? Because it's only stomach care. You know, stomach care is cleaning the stomach around it and then changing the bags, all right? That's something that's stable procedure. That's something that the LPN can do, all right? Teach ostomy care, letter D. Can LPNs teach? Can LPNs teach again? Can LPNs provide teaching? Yes or no? What's your answer? Yes or no? Can LPNs provide teaching? They cannot. The answer is no. Very good. But can they reinforce teaching provided by the RN? Can they reinforce teaching provided by the RN? Yes, they can reinforce teaching, but they cannot teach, right? Nurses or RNs provide the teaching. LPNs can reinforce teaching, all right? Very good, guys. Thank you for your responses. How about number 3? All right. The charge nurse on a cardiac step down unit makes assignments for the team consisting of an RN, an LPN, and a UAP. Which client should be assigned to the LPN? Which do you think can be assigned to the LPN? Letter A, 49-year-old with atrial fibrillation with RVR or rapid ventricular response, which means the ventricles or the heart rate is super fast. Letter B, 58-year-old with hypertension with possible angina. Letter C, 35-year-old scheduled for cardiac catheterization. Or letter D, 65-year-old for discharge, which can be safely delegated or assigned to the LPN. All right. I'm going to check my Facebook real quick to see how many nurses are online today. All right. So let me see because we're streaming it live in Facebook right now. Right. While waiting for your answers. All right, I think we have different. We have about 150 students online right now watching us live. Nice. All right, and I think we have different opinions on this one, right? But there is only one correct answer. Remember, LPNs can only take care of stable patients. So letter A is not a stable patient. They LPNs cannot take care of that. That's AFib with RVR. That has to be corrected immediately. Otherwise, it can lead to VFib. All right. Letter D, I'm going to remove letter D as well. Discharge teaching, discharge instructions, discharging a patient. It's only for RN, not LPN. So your choice is between B or C. Your choice is between B or C. Guys, the answer is B. Hypertension with angina are stable patients. Letter C, we cannot endorse that or assign that to the LPN because the patient is going for a procedure, which means this is a pre-operative or pre-procedure. The patient's in the pre-op phase, which means you need to perform certain tasks like cleaning the patient's surgical area, providing teaching, asking patients if they have questions about the surgery, making sure that they understand the consent that they signed for, making sure that their vital signs and labs are collected and they're normal. So letter C cannot be assigned to the LPN. Answer is B. They can take care of hypertensive patients, yes, because they can give medications. Remember, PO meds and possible angina. Angina is treated with nitroglycerin, which is a pill or a patch. Definitely LPNs can do that. Answer is letter B and not letter D, because I think a lot of you guys have answered D as well. But letter B is the answer. I'm going to show it letter B right there on the screen. It's highlighted in red. All right, that's okay. Let's proceed to number 4. I don't expect to have a perfect score because this is confusing for a lot of nurses, especially if this is the first time you've heard about delegation. And that's why we're doing this class. All right. A licensed practical nurse from the pediatric unit is assigned to work in a critical care unit. Which assignment would be appropriate? Letter A, we're talking about what can be delegated to LPN. Letter A, multiple trauma with newly implanted pacemaker. Letter B, new admission of left-sided weakness, stroke. Letter C, 53-year-old client with cardiac arrest and suspected MI or heart attack. Or letter D, balance, 35-year-old on balance traction, admitted 6 days ago after motor vehicular accident. What is the answer? I think everybody got it correctly. Answers letter D. Very good. A, B, and C, these options are only for the RNs, all right? Because they're unstable. Newly admitted patient, newly implanted pacemaker. Letter C is cardiac arrest. You definitely cannot endorse that to the LPN. Answers letter D. Very good. All right, I think we're picking up on the knowledge about delegation and we're getting things straightened up now. Number 5. Right? Which task for a client with anemia and confusion could the nurse delegate to the UAP? What can we delegate to the UAP? Um, this is an unlicensed assistive personnel. Can they document skin turgor color changes? Can they test for stool for occult blood and urine for glucose? Can they suggest food high in iron and those easily consumed? Or can they report mental status changes? What can the UAP do? What can the UAP do? Guys, let me tell you something. Remember, they cannot assess patients, right? LPNs and RNs can assess patients, but they cannot assess, which means they also cannot document, right? So letter A is for RN or LPN. Letter D cannot be performed by the UAP as well because that is a form of assessment that is out of their scope. They can perform skills, but they can never assess patients, right? They probably could see something abnormal, but they could not. You see this the statement. It says check the degree of mental clarity. You're checking LOC changes, or you're probably performing LOC neurologic assessments here. That's not a responsibility of UAP. That's non-delegable. The answer here is letter B. All right, testing for stool for occult. It's very easy. I don't know if you perform that, but it's a card. The doctors would get samples of the stool from the what you call this from the rectum, and then spreads it out to the two parts in the card. All right, and then we just drop some solution in there and look for change in color. Super easy for UAPs to do. And urine for glucose is super easy. We have iStats or little machines in the units, in the ER and ICUs in the floor, where they can just drop the urine and it can tell us if there's glucose or not, or can do bedside your what not bedside what's this I forgot what it's called, but urinalysis is right there. In the clinics, we do that as well, and in offices, in the ER, some ERs are equipped to perform urinalysis right at the bedside with the small machines. All right. So what I'm saying is, letter B is just technical skills. We just teach them how to drop the thing on the card to check for occult blood, and the urinalysis is super easy. They just drop it on a strip and put it on a machine. So letter B is the answer. Letter C is wrong. That's teaching. That's only for RNs. So A, C, and D can be done by RNs, but not UAPs. Be very careful. Remember, when it's UAPs that we're talking about, it's only skills. All right? No assessment, no evaluation, no teaching. It's only skills. All right? Now, next number. This is number 6, I think. Well, my slide says question number 1. It's question number 6. The care of which of the client can the nurse safely delegate to a UAP? Peripheral vascular disease with an ulceration of the lower left leg, pre-operative patient waiting for adrenalectomy, an elderly client with hypertension and self-reported non-compliance to medications, or a newly admitted patient with a history of transient ischemic attack. What task can we safely delegate to them? What's the answer? Can I see your answers? Oh my God. See, I'm sorry. I accidentally clicked it with my Apple Pencil. I'm so sorry. Answer is letter A, guys. All right, I've shown you the answer already. Client with PVD and ulcerations, we're just basically providing skills here. There was no procedure that was mentioned. There was no assessment that was mentioned. It's just saying what can be safely delegated, all right? Usually the care of these patients would require what? Checking if the wound is secreting fluids, or checking if the dressings are intact, checking vital signs if they're admitted. That's it. But pre-operative patient, letter B, we cannot give that to the UAP. That's only for the nurse. Letter C, you see the word non-compliance to medication. The nurse needs to perform teaching for that. UAPs cannot handle that. And of course, letter D says new admission. That's only for the nurse. All right. Next, number 7, 25-year-old client, unresponsive after a motor vehicular accident, is being transferred from the hospital to a long-term facility. Which staff member should the charge nurse assign this client? Who can take care of this client? This guy was like unresponsive and had a motor vehicular accident in the past. All right, this was this is being transferred to a long-term care facility, and this is a very unstable and kind of like high acuity patient. When I say high acuity, they are at risk for complications or dying or permanent disability. Answer is this is only for, very good. This is only for the RN. Very good. Alrighty. Next. All right, next. Number 8. Let me just have my coffee, all right? The measurement and documentation of vital signs is expected for clients in a long-term facility. Who can perform vital signs? The volunteer. Let's remove letter D. If it's only vital signs for long-term care patients are patients with chronic conditions that they need to be in a long-term facility. Who can perform it? It's vital signs, guys. It's skills. Who can do it? I'm sorry, I have to drink my coffee. I need to stay awake. No, but I love coffee. I'm sorry. All right, letter C. Very good. UAPs can do that. It's just vital signs. It didn't say there's an abnormal finding. All right. It didn't say vital signs to an unstable patient. All right. So vital signs can be performed by UAP. We're doing good. All right. We're almost done. Number 9. As the RN responsible for a client in isolation, um, which can be delegated to a PN, which can be safely delegated to a to an LPN. Reinforcement of isolation precautions, assessment of the client's attitude about infection control, evaluation of staff's compliance, observation of the client's environmental risks. This should be an easy answer. I think everybody got this correctly. Thank you for your responses. The answer is letter A. Without a doubt, I think everybody got it correctly. Reinforcement of teaching or isolation precautions can be done by LPN. B and C, do you see the word assessment and evaluation? Who does that? Only the RNs, right? Letter D is observation of the client's total environment risks. That's evaluating the environmental hazards. That's only for RNs. So the answer is letter A. Letter A, all right? Letter A. Now let's go to the last question and we'll wrap up in a few minutes. Which task could be safely delegated by the nurse to an unlicensed assistive personnel? I'd like you to answer this. We're talking about what can be delegated to a UAP. All right? This is this should be a super easy question for you at this point because this is the number 10 question. I think people got confused because there's like different answers popping on my screen right now in my comments section. We're now up to 160 people. All right, and that's good. And people, if they were not able to attend these meeting today, we're gonna put this in social media. You can tag them later so they can watch it. So I know a lot of nurses are working. We have different shifts. We're in different parts of the world. We have people from Africa here, from Europe, from Asia, and from Northern and Southern America. So we're all over the world today. And I know there's time differences, and of course, nurses are busy working. If they want to watch this later, just tag them on this thread, all right, so they can watch this class later. What can be safely delegated? As our last question, um, letter 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 A. Be with a client who self-administers insulin. No, we have to evaluate if the patient is performing it correctly, right? If the insulin administration subcutaneously on the tummy is being performed correctly. And plus, we need to do teaching. That's only for the nurse. How about monitor letter C? Monitor a client's response to passive ROM. That's only for the nurse. So now you're down between B and D. Which do you think have very least complications and can be safely delegated to the UAP? Guys, we've already eliminated C. I said A and C are for the nurse. Remember, when you see the word monitor, evaluate, assess, teach, show, observe, that's only for RNs and not UAP. Which has the least complication? Like no complication at all, are very safe to do. Even if they make a mistake, it's not going to cause harm to the patient. Letter B is wrong. Letter B can be done by RNs and LPNs, but the answer here is letter D. Guys, I don't know if you know the rectal pouch. It you can just like change it. It's just a pouch. It's a bag. All right. So they can safely do that. It's for elimination. All right. Now we've done all the questions. Can you show me your answers on the thing? Be honest. I don't care if your score is low. I don't expect you to have very high scores, especially if nursing delegation is such a new concept for you. And I'm giving you a demonstration of what we do for NCLEX classes. All right. I teamed up with Connetics USA to provide scholarship for nurses, foreign graduate nurses who wants to live their American dream just like me. It used to be just my dream when I was young to be in the United States. In fact, my parents sent me to nursing school to come over here to the United States, and it took a while, 9, 10 years, but I'm here and I'm happy and glad with my choices. And I really want to encourage you guys to really look into it, pass your NCLEX, and let us help you with onboarding you to your, to the process and getting you to the United States. Connetics USA has been very helpful to thousands of nurses over the years. So I'd like you to take advantage of that scholarship, of that free processing, and they can connect you to employer. It takes out the responsibility from you to look for your own employer, and they're pretty good with taking care of their nurses. All right. Oh, we got really good scores. People got 6, 7, 8, 10, which means you guys have very good knowledge about delegation. All right. So that was just a drill. Sometimes I do free classes as well. Please follow me on my social media as well for announcements about. Sometimes I do like full live lectures for like 4 hours. My full class is about 4 hours. So this is just a demonstration. But thank you guys for sitting with me. I think Luciana is back with us.
Oh, wonderful. I'm seeing some good scores in this chat.
Yes. I think they
We,
enjoyed the class, right? Did you guys enjoy it?
yes, if you enjoyed it, give us some sort of cool emoji, clapping hands, strong arms. I'm loving all of these scores here. We have some very smart viewers.
Yeah. And I think that was a lot of information for 1 hour. The thing is, with nursing, you can have information overload in just 30 minutes. There's a lot to know, but this is why we're doing these classes to help you guys get those knowledge that you need for the exam. All right. Thank you for joining us today.
Thank you so much, Paul, and happy Nurses Month to
Happy
all of
Nurses
you
Month
nurses.
to
Happy
everybody.
Nurses Month.
Yay. Thank you
Yes.
guys.
Look at the
Thank you guys
super
for all
pro
you
nurse.
do. You guys are awesome nurses. I mean, I can't imagine a world without nurses, period. So thank you guys for all you do, wherever you are practicing. Happy Nurses Month to everybody.
To everybody out there. And one more thing to add for Nurses Month, Connetics USA, for the last several months, we have had a referral bonus program that is actually going to be ending. It's seriously ending on May the 31st. So you have about 11 days left to refer a nurse. The nurse must have NCLEX. Whenever you do refer the nurse, give you $100. It's that, or $1,000. Excuse me, I missed a zero there. $1,000. Simple as that. Just go to conneticsusa.com/referral. That is running out, so make your way over to the website now. If you are a nurse with NCLEX, of course, go to our website and apply. It's conneticsusa.com/application. Our website has a lot of information for you, all sorts of resources, videos. The video of this show, of this wonderful class that Paul just completed, will also be on our website, so you can check it out there. Of course, join us next week, same place, same time. We're actually going to be doing an IELTS bonus class for you. So rounding out the Nurses Month with
Exciting.
all kinds of education coming your way. Thank you
Mhm.
so much, Paul. Thank you, everybody, who watched today and participated. Onwards and upwards. Take care. Goodbye,
Bye.
everyone.